So following this talk, there will be an opportunity to ask Dr. Kaggie questions. Please submit your questions throughout the talk using the chat function, and I will then collate the submitted questions and put them to Dr. Kaggie on your behalf following his presentation. And now I am delighted to introduce you to our speaker. So Dr. Joshua Kaggie completed his PhD in physics at the University of Utah in the US. His PhD involved building new kinds of equipment for magnetic resonance imaging. In 2015, he joined the University of Cambridge and has been involved in new physics methods for imaging cancers and osteoarthritis with better sensitivity. Dr. Kaggie currently manages the MRI equipment at a facility at Cambridge Biomedical Campus. So, Josh, over to you. Thank you very much for joining us today.
Thank you very much. Okay, so a little bit of background on myself as well. So during my undergrad doing a physics bachelor degree, I built some telescopes. And so these telescopes were gamma ray telescopes. This is actually me and my shoes right at the top of these things. And that was quite fun. That's actually what got me into science in general. And so keeping with the theme, imaging with light, all imaging is with light, but imaging with light in medicine, this captures what's called Cherenkov radiation that comes from the atmosphere, from distant supernova or other sorts of objects that hit our atmosphere and create these very fast blinks of light, nanoseconds, tens of nanoseconds long, that are in the ultraviolet spectrum. And so that's what started me off into physics PhD. I just really wanted to do MRI. But a bit of other things that I've been involved with outside of research. I was involved in a flash flood in the Grand Canyon, so I have some very unique photos from that. And was helicoptered out of that. And I also lived in Denmark for a while, doing something related to Mormonism. So let's go to science. What is light? And so very much with the theme, everyone would know that light is something that we all see. You can put white light through a prism, or you can see sunlight spread throughout into different colors and make a rainbow. And what's fascinating to me is that the light that we see comes from just 3 different colors. I mean, it's just absolutely amazing to me that from the blue cones in your eyes, green cones, red cones, from these very specific things, you get this range of things that you can see. It's not quite scientific-y, and that would end a presentation if all we said was that we saw within medicine the light that was visible from our eyes. But continuing on, what is light? Light is the collection of photons. And what's a photon? It is a packet of electromagnetic energy. So with this much broader definition, we're going to use electromagnetic radiation, the full spectrum of it, from microwaves to X-rays and even gamma rays, and show different kinds of imaging methods. And so the first one is optical, it's luminescence, and here I have what's called a multi-photon imaging system. And then on the right, with very high frequencies of light, we have X-rays or CTs and gamma rays that come from PET imaging, positron emission tomography, and I'll explain this a little bit more. And then on the left, on the other end of the spectrum of what we can see, we have MRI, which generates signals from radio waves. But I also thought, I was wondering about this particular question. Is a hug light? Because everything's electromagnetic. I would say yes. Is this related to medicine? Maybe. But let's go over the types of electromagnetic radiation. Visible light is those things that you can see. Infrared is heat. And we also have on the range of light microwaves that we can use in cooking in our phone in an MRI. And along with that, radio waves. that we have in our mobile phones and our radios that we might listen to music from. And so that's where MRI lies. On the other side, we have ultraviolet light and X-rays and gamma rays that can be used for imaging and for killing cancer cells. So there's our range of electromagnetic radiation or range of light. So is a hug light, going back to maybe not so scientific of a question, I'd say yes, in several ways. One is when you hug someone, you have the synapses that transfer electromagnetism from wherever you're holding a hug to your brain and across your body. You get infrared warmth, you get warmth from the hug itself. And so that's kind of like you get visible light from someone that you might see. And maybe a bit of a stretch, but if sticky tape generates X-rays, maybe a hug does in some very, 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 very small way. But going back to science and medicine, so visible light, how that would be used in medicine is obviously a doctor might be able to see when you wince in pain and be able to change the treatment based on that. There's cameras that would be able to be inserted or used in several ways with endoscopy to image you internally. Going to the multi-photon imaging, this is visible light, but it can be used to image things that are on the surface and be used to target things very specifically. And so here we have multi-photon imaging that targets types of immune cells and blood vessels. Moving on from visible light, we have X-rays. So here we have the X-ray of a hand. And fun fact, the X-ray was discovered on accident. It was when Wilhelm Röntgen, was trying to test other sorts of physics methods, cathode rays, and happened to notice that these excess of their rays stuck on a plate nearby and was able to pass through objects. So that was our first imaging that was non-invasive. And from the development of X-rays, we then have the Beatles. Now, what do the Beatles have to do with X-rays? Actually, surprisingly, a lot. So in the 60s, the group called Electronics and Music Industry, EMI, at least according to rumor, had a lot of excess money. And so they developed what was originally called the EMI scan, which later turned into be the CT scan. And so this was developed in 1972 by Sir Godfrey Hounsfield, and it was built on mathematics that were developed over the 20th century, early part of that. And within 10 years, over 3 million CT scans. So these things, CT scans, are X-rays, but they're done in 3 dimensions and can give very lovely photographs of bones and some sorts of tissues. And the way that works is by using this thing, which is called a cathode, and rotating it around an object and using multiple of these and getting multiple views of an object to create an X-ray, or sorry, a CT image. And CT image is very sensitive to density. And so here you can see different kinds of tissue available in CT, which is very specific based on what's called a Hounsfield unit. It's actually a measurement of density. And so bone shows up incredibly well, whereas tumors do not. And so this is just a nice 3D example of a rodent skull that we've obtained here. And what we can do with X-rays using very similar technologies, inject a radio tracer. And so this would be a radioactive material. It collects in certain tissues and then gives off radiation. And it uses very related technology, perhaps tuned to slightly higher frequencies. But this allows us to do rapid imaging of metabolism in different parts of tissue and be able to collect these sorts of maps. And the thing is a lot of cancers are very metabolically active. So many of these radio tracers can target specific cancers so that we can see them very sensitively. And so the way that we might do this is we often do this with something called glucose or fluorodeoxyglucose, which is essentially sugar where one of the chemical groups has been replaced by a radioactive tracer. And then this goes, you ingest or you inject this glucose or fluoroxyglucose, FDG, and then after it's collected in a cancer, it then gives off what's called a positron, which hits an electron and then emits 2 gamma rays in opposite directions. And we can use this sort of thing, both timing of when the gamma rays hit and which of the detectors the gamma rays hit, to then be able to reconstruct an image and be able to obtain where is metabolically active within a brain. And so that is gamma, that is PET combined with CT, and it uses these fancy mathematics, which are called radon transforms. And in terms of the types of radio tracers, at least here within Cambridge, we have 2 main things that are possible and used in many clinical studies. And the reason for this is that both carbon-11 and 18 fluorine are radioactive. And these have long enough half-lives to be useful, but short enough half-lives to have decayed so that they don't cause other damage in other places after a patient or an animal has left the center. And so we tend to use those 2 specific radio tracers. There are others that are in development, and these target many different kinds of diseases, mostly, I would say, used in brains and oncology or tumor imaging. But let's go back to the beetles, stepping back again. What do beetles have to do with the opposite direction? Probably not much, but they have been on the radio. And so we will talk about a different imaging technique using radio waves, which I've already mentioned, and that would be MRI, which uses radio waves not too dissimilar from what you might get from your FM BBC channel. Actually, this right here is me inside of an MRI coil. And so this MRI coil actually resonates at 128 megahertz. Your radio, BBC, is about 100 megahertz, depending on the station. So they are very similar in that regard, other than the shape here. One of the differences is with your radio, FM radio, you want to receive or transmit from distant locations, whereas here in an MRI, I want to localize that radio wave specifically to a head, to a specific location, and be as sensitive to, say, that head or body part as possible. And so I try to minimize that distance to increase that signal. And so that's the relationship of MRI to a radio wave. The MRI was first done in 1977 within a human, and the Nobel Prize was awarded to a Sir Peter Mansfeld from Nottingham in 2003. And so here we have a preclinical or an MRI that's used for mice and rats on the left. Here is a human MRI, and I just want to show you the strength of it. This is a 3 Tesla MRI, and at the end of the string, I have a little magnetic loop, a little bit of iron. And so it's quite a nice effect being able to see something that just floats in air, but it also shows you the potential danger of an MRI if you do have things that are larger than that. So to describe how strong an MRI field is, the Earth's magnetic field is, you might say, about 1 Gauss or 0.0006 Tesla. The field of a magnet is about 50 times that you might put on your fridge. And if you're in a junkyard, then about 10,000 times the Earth's magnetic field is what is typical. And then the MRI that you just saw is about 50,000 times the Earth's magnetic field, and that's measured in Tesla. and that is a 3 Tesla machine. And so that is my standard workhorse. And inside of an MRI, in order to get that strong magnetic field, what we have is superconducting wire, and this is called neodymium. There are different alloys, but one of them is predominantly neodymium and molybdenum, if I said those correctly. But the way this works, or an MRI works, is right now, the atoms in your body are just generally randomly aligned. You have about 10 to the 21 hydrogen atoms in your body, and they're spinning in all sorts of random directions. But the moment I put your body into a strong magnetic field, those hydrogen atoms or protons tend to align with this field. And so they then do this thing which is called precession. So precession is a funny term. It's something that most people aren't quite familiar with. But the way to describe it is that you might have a day where you have something that's rotating around, but then you have, actually, that's a bit of a terrible way to lead into it. But in about 23,000 years, our seasons, our days will reverse. Our summer will be in December when we're in the Northern Hemisphere, in about 23,000 years. Because the tilt of the Earth precesses, it changes. And that's what happens to this top or gyroscope in a gravity field. It's also what happens to a hydrogen atom. It's spinning around in one direction, but then it is spinning or precessing in another direction in a magnetic field. And that precession is directly related to the magnetic field and to the type of atom. And so that's what we target specifically with that 100 megahertz radio frequency that I mentioned. So going back, we have our 100 megahertz, 128 megahertz that we generate. We send that into your body, and then your body gives off actually 128 megahertz signal back. And so we use this magnetic field to generate that and to get the signal back. And if we pulse this radio wave at different rates, or if we wait an amount of time before we get the signal back, then this is all the same water tubes, but we can generate what are called different contrasts. And so different brightnesses or darknesses between various tissues. And so this is largely what I work with, is trying to optimize how we get these different types of signals. And so MRI can measure all sorts of signals, and these are some of the basic ones, actually. But moving on to how do we actually generate an image? Well, going to a magnetic field, if I have a magnetic field that's lower, say at someone's foot, and much higher at someone's head, then these frequencies, these precessional rates of these atoms are different. And it's a bit like playing the piano. Like, I can play all the notes at once, and depending on how many atoms or nuclei are there, it gives a stronger signal or a weaker signal. And it actually is very related to how you might try to pick up the tones that someone is performing on a piano, as much as it may not make sense, but it is very similar mathematics. And so you essentially play a song. And so when you're in an MRI, it creates all sorts of noises, but if you vary the magnetic field in 2 directions or 3 directions, then you can play all sorts of encoding methods. And the way you obtain then an image from this is you collect what I might call different kinds of songs, but different kinds of spaces, and collect this information. And then it's what's called a Fourier transform, and it very directly turns into an image, quite surprisingly. Moving on to what kinds of data can you get from an MRI? So what's interesting is within your body, you have both fat and you have water. And here on the left, this is a water image. And on the right, this is a fat image. And the way that these are separated is that they are very slightly different frequencies. And so I can target either frequency to be able to obtain them. But then there are also a lot of other atoms or nuclei that you can target. And we'll talk about that in just a second. And those are very interesting for developmental purposes. But let's just go through the types of images that we collect actually quite routinely. And so this would be a brain. And so stepping through, at least on the right is a brain. You can see the eyeballs at the top, the cerebellum on the bottom. On the left, this is the cochlea, the inner ear. And so that's quite high resolution. And so you get very good contrast between white and gray matter. Here, what we can do is we can target, we can do what's called cinematic imaging. And so this is a cine of the heart. And so we can see it beating. And so then this can help us tell how much a person's heart is working by seeing how much of the volume is being filled, or how dense those outer layers are that are surrounding the heart, and being able to measure parameters that way. And then here, this is called an angiogram. And so what we can do is we can target nuclei with, as say, applying a radio field at a different location, but then those are the spins that are giving me signal back. Basically, the point is I'm tagging the blood and then watching that blood flow. And I do this through very clever use of my radio waves. And it's quite beautiful, actually. And then I have a boring old knee, but this is a knee scan where I have the tibia on the bottom, femur on the top, but very useful if you have an injury. So here, doing a bit more interesting physics, this would be prostate, but we can also encode it. We can do more clever things with our MRI and how we play out our magnetic fields to be able to be sensitive to the directions that water moves. And so on the right is called a diffusion image. And that has been one of the most useful things in the last decade or two for determining whether a cancer is benign or malignant, is diffusion imaging. And then just other examples of types of imaging that we can get. Here I have a cochlea again, it's an excised cochlea. And so this is 60 microns by 60 microns by 60 microns. So it creates a very lovely image, and this is at a 3 Tesla magnetic field. And then on the bottom right, I have the heart of a mouse. One of the things that I personally am working on is trying to follow glucose and how that is used in MRI. And so we've modified glucose, or we use modified glucose or pyruvate. We attach heavier elements to it. So most of your body is water, hydrogen, H2O, but 0.01% of that is heavy water. But this resonates at a different frequency. And so I personally have built, actually I have it right here. I don't know if you can see my camera, but equipment like this, which is a radio frequency coil. And that is tuned to a different frequency than your normal scan. And so we can target carbon, but it has to be carbon-13, or hydrogen, and there's some funny nuclear physics as to what can be targeted or not, but generally, well, carbon-12 cannot be imaged with MRI, but by tagging it this way, we can follow the TCA cycle, the citric acid cycle, which then actually helps us distinguish different kinds of cancer, whether a person is responding to a treatment or not. There are other things like a cell has very common dynamics wherever you're at. For example, whether it has sodium, and again, these types of things relate to many different kinds of disease where the sodium is at. And so that's actually what I work on. And so this is the paper, comes from a paper that actually was just published within the last 2 weeks, and something I'm personally very excited about. It's doing carbon-13 imaging in the brain and seeing how, and deuterium, or a heavy hydrogen glucose imaging, and seeing how that then converts into different kinds of metabolites. And so glucose then converts into what's called glutamate or glutamine, and pyruvate can convert into bicarbonate. By using these sorts of measures, it should actually help us tell whether a person is responding to treatment. They're poor resolution, but they give us these spectra that are actually very important. As for other things that I work on, again, sodium is, these atoms resonate at different frequencies than your normal MRI, so we have to develop very special techniques for them. But this is sodium in a breast cancer. And so you can see a lot of highlighted sodium. Another technique that I think will get up and running within the next 4 months is called Xenon Imaging. And so this is very new. Again, it resonates at a very different frequency. But what this does is we will magnetize xenon, a gas, and have someone breathe it in. I actually helped with this particular data at Papworth, and then image that so that we can then look at, say, COVID or for other sorts of respiratory diseases. We're personally interested a bit in cancer. And then there are other sorts of methods that I hope to develop based on a conference that I had just attended, and that I think are very interesting, that target other atoms, other nuclei like potassium and chlorine, and being able to gain information from those. And so those, I think you'll see more of from myself in coming years. But this is sodium in the brain. This is a sodium MRI. And so you can see right next to it, that's called a phantom or fiducial. That's just a sodium container so that we can then calibrate against that. But then we have sodium in the eyes and sodium throughout a lot of blood vessels, and sodium tends to collect in a lot of cancers. And so this right here on the far right is sodium in a glioma, and we hope to use this to be able to distinguish certain types of cancers. And then imaging sugar, this is that carbon-13 that I mentioned before, but this is a carbon-13 MRI that then converts into lactate or bicarbonate. And again, these sorts of rates of conversion, or how much they convert into one or another, should be indicative, and they seem to have been indicative in all the work that we've done on whether a person is responding to a treatment for their diseases. Then other methods that we work on at Addenbrooke's, I realize this is MRI heavy, but it's but this is on the top left, using iron to cause it to disrupt the signal, because iron is slightly magnetic, and that can enable tracking of cells on the top left. In the middle, that's acquiring rapid imaging to be able to accelerate how fast an MRI can be obtained and be able to make it more reproducible. On the top right, that's called zero echo time imaging. That's imaging bone with MRI. And the reason for doing that is to save people from radiation of CT, in particular pediatric patients. But with most bony diseases, these are very slowly forming diseases. And so we want to be able to just save that radiation over time. And then on the bottom is machine learning methods for automatically identifying different tissues that we are working on. Hopefully the latency isn't too bad on everyone's end, so you can see some of these pretty videos. And then here we have the cinematic MRI. This is someone drinking water. Just kind of a cool image. Moving on from MRI, which I spent a lot of time on because that's what I focused personally on. I also am doing what's called Msot imaging. This is called multispectral optical tomography. There are two other words for it: optoacoustic imaging or photoacoustic imaging. What happens is that this probe here in the middle generates laser light, and it generates laser light in the infrared spectrum. And then that laser light targets different tissues, and this can be blood or oxygenation. It could be cells that we've labeled. And by generating that light at a particular frequency, it then can induce ultrasound. So moving from light to sound, And the reason why you might do this is because it's could be cheaper than MRI. And if it can be just as effective, then maybe you can screen a few more patients in a faster manner or be more specific about it than MRI. But we're using this for tracking cells in osteoarthritis subjects. So this is using the infrared. So I've covered quite the range. There are things that I haven't covered. There are also other imaging techniques like radar. And so this uses very high frequency radio frequency. This is a breast scanning table, and it probably looks, the images look a bit like that previous slide with the photoacoustic imaging, but this then uses arrays of radar detectors and transmitters. We talked about MRI, moving through the frequency. We use heat or infrared to generate an ultrasound image through this laser light, so laser to ultrasound. We talked about endoscopes and cameras and luminescence, which is invisible and, well, actually extends the range of things. And then we've also talked about X-ray, CT, PET. There would also be SPECT. And there are also plenty of other techniques that aren't within this range of methods. One of them, back to my gamma ray, is actually called Cherenkov Imaging. And so that's even further on the spectrum. So you can see that people are exploring quite the range of electromagnetic radiation. And there's even well more than this. It's just these are mostly the macroscopic that we would do in patients, but there would be plenty of things that you wouldn't do in a patient directly. For example, atomic force microscopy, maybe you might do on a small sample from a patient. Oh, that's the sound of an MRI. Oh, wait, my video show. Sorry. I didn't line up. This is actually the sound that's coming from an MRI. So I talked about encoding it. Maybe we can do it because those are large speakers. But it's just manipulating magnetic fields to generate different frequencies and using that to generate images. So, thank you.
Thank you, Josh. That was a great way to finish the presentation indeed. I see some other awesome comments about it. So, well done. I open the floor for questions to see whether it was just impressive. I always find this, yeah, again, kind of all the techniques that you have in the whole range, in the whole spectrum of light to target, again, medical diagnosis. It's just the field now to be in, I think, all healthcare growing. So I'm not sure, again, if someone wants to throw a couple of questions or not. I was going to ask about, let's see, well, there is, okay, question from Ella, and then I'll go for mine. What do you think is the coolest or most impressive thing about light? And what is your favorite form of light?
Well, my favorite form of light would be that from MRI. I mean, that's an obvious. But the coolest, most impressive thing about light is, I mean, oftentimes people talk about light being a wave and a particle. I personally don't care. But the thing that's the most interesting to me is just the fact that, so you have electricity, you have your power from your wall sockets, and it's not actually the electrons or the protons moving through that. I mean, it's generating electricity, but that's not how that's being communicated with the rest of the universe or rest of the particles around. It's the fact that it's photons. And that blows my mind every time I think about it. It's just the fact that light is how magnetism or electricity or every funny little thing And to be honest, I don't actually know what frequency, when you have just a simple AC or DC current, that your photons are being transmitted at. Actually, this is a question I would like to have answered. And it feels funny because I have a physics PhD and something that I should have looked into. Yeah, but that's the most mind-blowing thing to me. Quick though. The most impressive thing, though, is so photons are the carrier of electromagnetic information. The thing is, most of your interactions with anyone, everything, so you have the strong force, the weak force, and you have gravity. You can ignore most of those things. Like most things, when I'm pressing my hand versus my hand, it's still EM in some way, electromagnetic, largely defined by that.
Okay, so we got the point. It's just like light is basically everything.
It's everything, yeah.
Right, no? That's a good one. My question was going to be similar to one that Jay has put through, which actually, if someone wants to just unmute themselves and ask their question, please feel free to do so. So Jay, if you want to go for it, otherwise I'll just pass it through. Okay, so the question basically is, are most of these things available in all hospitals, or hold on a second, or is it only in the bigger ones? And I guess it ranges from MRI to I guess ET.
Yeah. So the biggest thing is the cost associated with them. So an X-ray is going to be in nearly every hospital, a CT in more, but so it's cheaper than MRI, but it's still quite expensive. And then one of the issues is that the more complicated the imaging method, the more training the individuals, the radiographers, need to be able to use it. And so you end up having a cost simply for materials. Like an MRI has actually miles of superconducting wire that's just wound around. And that itself is expensive. And then you have all of the training for the radiographers. So for MRI, we have them scattered throughout, say, East Anglia and Norwich and several other centers. But it is in the larger hospitals, and that is largely just economic related. A lot of the patients get referred to, say, here or the other major centers. And then for a lot of some of the other techniques, they are still limited to research. One of the issues is trying to get more imaging methods to more places. And so that's one of the reasons that some of these other things that I mentioned at the end are being developed, is just because they would be able to be distributed a bit more, simply because they would be cheaper and ideally require less training to be able to use them.
Good. Another question, it comes from CDA to learning, and it's about harm from these techniques, from the use of light to the body or to the natural environment. So what could we do to minimize negative impacts? So I guess it depends on of course, on the technique and all that, but can you put some examples about things maybe that we're doing in terms of minimizing any harms potentially?
Yeah, I'd say those are two different questions for human bodies or the natural environment. The human bodies, so two very different things. One is you have radio waves that are just passing through you all the time, that they don't interact. Like you have sunlight that gets stopped mostly at the skin. Obviously, there can be some damage, but for the most part, like magnetic fields don't cause any real damage or any known damage, at least at our field strengths that we're working with. And even the radio waves, we limit the amount of power that can go into a person. And so there isn't any known damage that can occur from an MRI from that regard. Obviously there's the range of light, and so if you're doing things like the CT or PET scanning, then I should have mentioned those are ionizing radiation. If you do have that too frequently, then you can actually induce some cancers. And so this is something to be watched out for. And so we tend to avoid doing those in individuals that, I mean, unless it's strictly or necessary. I mean, unless there's a very strong reason where it might very much prolong a person's life if they have this analysis, this imaging. So MRI, mostly completely safe for a human, no known harms. I mean, strong magnetic field can cause projectile effects, but on the other end with the PET and CT, those are ionizing, so we do limit those. So two different answers. So we just monitor the amount. In terms of the natural environment, again, that's a very big question. At least for the centers, again, if it's not causing harm to humans, then we limit the environmental impact at least immediately around. I think producing equipment probably would cause some damage to the natural environment, but that's a question that I'm not equipped to answer.
Yeah, I was going to say, yeah, energy consumption, all that material manufacturing, but yeah. Perfect. Not sure whether, again, just feel free to drop some more questions in the chat or unmute yourself. I was going to go for something a bit tangential, but maybe you can you have a bit of a feeling of how this field is going, and it's when you mentioned, for instance, infrared image, well, infrared imaging, or you've mentioned imaging techniques, let's say. But what about this sort of new research on small particle drug delivery? That is then, you know, if you manage to couple whatever particles or nanoparticles to certain cells, and then you release, you know, that load, or you trigger somehow that sort of particle to do something with, I think there's, again, there's infrared or there's magnetic field for it, or do you have a feeling of how that's working? Like, whether there are treatments that also go for using light to not to diagnose, but also to treat?
So
well, you mentioned, yeah, that's PET and vehicle. Go ahead.
We can do two different answers. One would be with radio waves, and so one way is, say, you might inject a drug or some cells that then target or get inserted into a certain tissue and collect there. And so if those absorb radio waves much faster than a body, and metal does, I mean, this is the danger of, well, okay, so one thing is, if you have certain kinds of tattoos, that is actually what's called a contraindication for MR. You might not want to go into a research scan, but using that sort of property, that if something is very conductive, very iron heavy, or otherwise, and if it's collected in certain cells, then I can use radio waves that target that and then heat up the say a tumor from the inside out. So that would be one way to use light or radio waves to kill a tissue that you would target. And then on the other end, so that would be the radio wave, then going to the other side, with PET and CT, you have what's called theranostics. And so again, this is quite common in like thyroid disease. Maybe you have certain kinds of tracers that collect there that also emit so that you can image, but at the same time are killing, say, overactive tissue that you want to get rid of. And so this would be a common treatment for hyperthyroidism, to actually kill the thyroid, where you have simultaneously a radioactive tracer that does both. So yeah, there are plenty of disease ways of treatment, and there will be more. It'll be much more difficult to keep track of in 10 years, I suspect.
Yeah, I guess this is again an increasing techniques in the field, definitely, and more ideally more investment going into healthcare, which is good. And yeah, so I think again, if that's all, I just wanted to ask you if you can give it. I mean, you mentioned some things that you're working on and you may want to do in the future. In general, where do you think the field is going? If you could have a bit of a, just like, how do you see the field in, 20, 30 years time? What sort of things people will be researching on or will manage to have developed by then?
Oh, I actually think it'll get a lot more interesting. But a couple of things that I do see is happening. One would be low field MRI scanners. So you talked about, someone asked the question, are these in all these centers? And one of my answers was no, because of costs. But I actually have a small little low field MRI right behind me in my home. And so one of the things that you will see, I think, within the next 10 to 20 years is low field MRIs that become more abundant in small little clinics that people can easily use. It'll be integrated with AI. That's because part of it is we develop these things for high field MRI, but then we figure out all sorts of new techniques and problems and methods. And then those can be translated back to using lower MRI fields. So that will definitely, I'm pretty sure that'll be a change. You'll see MRI, low field, more and more places. But for research methods, I think for the big clinical centers or big research centers, it'll probably keep a bit like today, where you have very, very specific techniques. So that carbon-13 measurement that I showed, where it was glucose to pyruvate, I mean, it's too complicated to spread out far, but if it helps certain cancers or certain diseases and it helps you to find that pathway much better, then it makes it worth it for those individuals. And so we'll see big research centers do more kinds of imaging within a quicker, faster session. That would be my prediction, is those atoms that I mentioned, those nuclei, being able to actually obtain those within a single 20, 30-minute scan instead of multiple 30-minute scans, one after each other. And that is technology that I think well, that's my personal interest, to really get at more of the physics and biology that is available there. And then for within other range, like I pointed to different kinds of imaging methods, like the radar. I think you'll see that in clinics that will be useful. And then with PET, you'll see more targeted radio tracers and some more molecules that target very specific diseases. And so you'll inject it, it'll collect a bit more in, say the knee or the gut or whatever, and it'll give you activity for something very related. Whereas now we have, I'd say, a bit of a, you might call it a specificity problem, but we'll see more molecules being developed. I mean, to be honest, I just see progress in all different directions, and I think it's quite fascinating and it's quite fun to be part of. And I don't know how many people here are looking for PhD studentships, but we definitely have plenty of places or people who would be good to work with, whatever you're coming from.
So that's good. Actually, I was going to encourage people to try and look more into that direction, and maybe just like share the passion that you are showing with other people. But yeah, I think there are not more questions. I think that's about it. So again, any quick question, just do it now, or otherwise contact maybe Dr. Joshua Kaggie in the near future. I think that's about it then. Okay, Josh, thank you very much for joining us, and we hope to see you soon in college or again in any other activities. Please tune in for the coming live from Lucy, and of course check the ones that we have on YouTube. So yeah, with that, thank you everyone for joining us today, and yeah, we hope to see you very soon. Bye for now.
Bye.